Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. What's going on? Dr. Chris here. Today I have a very special guest. I have Tracey O'Shea. How you doing today, Tracey?
I am good. Thanks for having me.
Yeah, I'm very honored to have you. I've known Tracey for just over a year now. Is that right, Tracey? I think so.
Yeah, I think so.
I enrolled in her functional medicine course, the ADAPT program, which is fantastic, by the way. I learned so much. I absolutely love that program. I recommend it to other practitioners all the time.
Yay, I'm so happy.
So will you tell me a little bit about your background?
Yeah, so I'm a functional medicine nurse practitioner, and I've been practicing functional medicine for almost 10 years now, probably. Really, I grew up with a chiropractor for a father. And, so we were a little bit more on the integrative kind of quote natural side of medicine. And I knew I wanted to be in medicine, but I definitely knew I didn't want to kind of be in the mainstream model. It didn't resonate with me. And I kind of stumbled into functional medicine and never looked back because it really just resonated with me. And it just felt so true to what, I really believe is our way of healing and really being able to help people thrive and, find their healthiest selves. So I just feel so grateful. And I've been so fortunate to find this kind of early in my career. And I work at the California Center for Functional Medicine. I'm the medical director there as well. And we see just a real variety of chronic illnesses, anywhere from, chronic GI issues to hormone replacement therapy, to Lyme disease, to heavy metal and mold illness. So we really have seen the gamut of people, anywhere from people that are really suffering from chronic illness for many, many years to really wanting to kind of optimize, kind of the biohackers, if you will, really wanting to get the most out of the years that they have. So that's my background. And I'm also, as you mentioned, the director of a training program for other functional medicine practitioners. And I'm a little bit of a collagen nerd as well. And so we're going to be able to talk a little bit about all of those things.
Yes, we're definitely going to dive deep into the collagen. Question, what's like your elevator pitch for when people say, well, what is functional medicine? Because I'm still trying to get that down. Like, what's the short version of that?
Yeah, so I usually explain functional medicine as a systems-based approach to managing disease, right? The recognition that all of our systems are connected and that we really are trying to build from a foundational place out. So instead of kind of the more traditional model, which is symptom management, you have a symptom, here's a pill. You have a symptom, we give you a diagnosis and send you on your way. Functional medicine is really looking at the whole person and understanding the intricacies of all of the systems that work together and really working to find the root cause of your illness or the root cause of symptom so that we can really get you to a place of healing and thriving and not just managing symptoms.
Yeah, that's exactly what drew me to functional medicine in the first place, because it's kind of the same ethos as physical therapy. We're all about, if there's a rock in a shoe, don't just put more insoles in, remove the rock in the shoe, get to the root cause. So when I heard you guys talk about this, I also felt like it was the piece that I was missing in physical therapy. I was seeing all these sort of systemic things and not being able to solve that. It was frustrating for me. So I want to be able to solve everything. So that's what really brought me to it. Question for you. How long were you in sort of, I guess you'd call it mainstream medicine before you transitioned to functional?
Yeah, I probably was doing that for probably 3 to 4 years. And I was in pain management of all things, which I think we all really know, it's shifted and evolved into, I think, a better place, but just historically, chronic pain is a very difficult and tough disease to treat, and especially in kind of the traditional model. So that was a very different patient population. And we were really trying to transition those patients into a functional medicine practice, which was a little tough. because I think that particular pathology has so many components and it's so nuanced and intricate that it's hard because there's also a belief system that exists, in kind of that more traditional pain management model. So it was tricky, but it taught me quite a lot about just the psychology of disease and the psychology of pain, and really trying to speak to people's hopes and wishes, for being able to thrive. So it wasn't too long, but it was long enough, I think, to be able to kind of, pull some information from that. Yeah.
I imagine the burnout rate's pretty high in the traditional pain management setting because, I used to do home health physical therapy, which I kind of reminds me of a similar concept of like, I wasn't really seeing people get better. At best, I was helping people slow down a disease progression. I didn't feel like I was fixing anything. And I feel like the mainstream medical model does not do great with chronic pain, right? Because it is super complex. And there's so many factors to it. And this is where you get into pain science, right? And you probably just didn't have the kind of time you needed, will tell me, to spend with your patients to actually get to the root cause of their issues.
Yeah, I mean, we started, doing injections and epidurals and, radio frequencies and those types of things. And then we really did try to transition. We created a functional rehabilitation program that was kind of more from the workers' comp perspective. We started doing group appointments. We really kind of started, transitioning. And I think that it was received pretty well until we started cutting back on meds, right? And then that was a little bit of an adjustment for a lot of people, but we really came from a place of educating and, what's your pain point? Pun intended, but what's the pain point? What's your problem? And how are we going to be able to solve this? So yeah, I think we gave it a valiant effort. We really tried. And, the practitioner I was working for, was retiring and I was looking for something a little bit different. And that's kind of, how I ended up at the California Center for Functional Medicine, kind of took that leap and just dove headfirst, really.
That's great. And you've been practicing functional medicine, said 10 years now. Is that right?
Yeah. Yep. Almost 10 years. Yeah.
Do you love it? Do you, let me ask this, on Sunday night, how do you feel? Do you feel like, oh, I got to work on Monday?
I mean, I love it. I think, there's always a balance, right? As a healthcare professional between, I think we really are driven to help people and we're nurturers, at heart. And I think that with being a nurturer, especially with the complex illnesses that we manage, we take on a lot, I think. So there is a balance between that excitement and drive to help people heal. And it's so great to hear people's stories. And, I really hold on to those, people that are like, thank you for saving my life. Now I'm traveling with my kids and I never got to do that. Be able to have children, all of those things, just you hold on to them because there are days, right, where you really absorb a lot of that energy of suffering, for people. And so I'm extremely grateful. And yes, there are days, no matter what kind of medicine I think you're practicing, where it can kind of hit you and it can feel like a lot, but it's a delicate balance of trying to learn how to feel that excitement and take that in while also kind of protecting your own energy, I would say. But yeah, I think I do wake up and I'm just so grateful that I get to do this and then I get to share it with other practitioners and that we're in this community of value aligned people, because it's isolating if not, and I'm excited about the movement. I just think it's amazing.
Yeah. You mentioned absorption. So this funny thing will happen to me. I know it happens to a lot of practitioners where if I see 3 patients in a row that have knee pain, I'll for sure have knee pain that night and the next day. And I know it's not real. I just ignore it, but you totally absorb it. It's so bizarre.
Yeah. Yeah. I mean, we're creatures of energy, you know what I mean? It's impossible for us not to. And, I was just listening to, something else about, emotional intelligence and personality intelligence. And there's mirror neurons, that exist. And just evolutionarily, we've evolved to have these mirror neurons to kind of mirror what, who we're communicating with and who we're in. And I suspect it's probably just a tribal, evolution, survival thing, but it's wild, right? That, I mean, we really do mirror the person that's in front of us and the people that we surround ourselves with, and both positive and negative. And those energies, it's impossible really to try to completely avoid it. So I think, we really have to be pretty present and intentional when we're with our patients, for sure.
Yeah, and so I've never heard that term, mirror neurons. I love that. I mean, that makes sense. They always say like you're the sum of the people, or you're the average of the people you surround yourself with. It totally makes sense.
Mm-hmm.
Okay, cool. Let's switch gears and get right into collagen. Tell me why you are obsessed with collagen.
Yeah. So, I mean, that wasn't how I set out in my life. Like, I'm not going to just be like a collagen guru, but I just kind of naturally evolved. And I think, coming from a chronic pain background and really being pretty fascinated with the complex pain model and the psychology of pain and the structural components of pain, I knew how important collagen was. And, I started to, just like everybody else, okay, I'm here, I'm understanding. I understand the importance of collagen. And as we learn, and I'm doing what everyone else is doing, like here's some powdered collagen, just kind of doing what we think we're supposed to do. And then I really kind of dove in because I was not really satisfied, to be honest, with like the results that I was getting for myself or for my patients. And, we all spend a lot of time and effort in trying to make ourselves healthy and put our best foot forward, both with supplements and diet and lifestyle and all these things. And, we only have so much time and energy to give. So I always want to make sure that it's going in the right direction. And so, yeah, I like dove in, found, which we're going to talk a little bit more, found a lot more out about collagen and what's the best type. And then I started transitioning over to that. And that's really where my interest grew, because I really started seeing pretty amazing results and benefits for myself and for my patients. And that's just kind of how that happened. You get excited when things start to work, and then you're like, okay, I'm going to put more energy into this and figure out how I can help more people. So it just kind of, I think, has evolved over the years.
What are the typical results that you see? What are like the biggest changes you see when someone's, and the follow up to that, how long does someone really need to be doing collagen for to start seeing a benefit?
Yeah. So, I think, and we'll talk about this, I think the type of collagen that you're taking, the bioavailability of it, the quality of that collagen, and the absorption rate of that collagen. I mean, those are all kind of common sense things, right? Like anything that we're putting in our body, we want to make sure we're checking off the boxes. So making sure that we have the right collagen that our body is taking in and is helping synthesize more collagen. We're going to talk a little bit more about that and why that's so important. But for me, with the shift in the type of collagen that I'm recommending to patients and using, the things that I'm seeing mostly is, first I'll kind of start to see improved hair. Like I get a lot of hair loss, hair thinning, hair shedding complaints from people, whether that's postpartum, post-COVID, nutrient deficiencies, autoimmune diseases. There's kind of a realm of things that can kind of go into that. But I will see, improved hair loss initially first, and then nail growth, like those types of things. And then that kind of quickly transitions to improved joint pain and mobility. We've seen, especially with osteoarthritis, I see that a lot with my osteoarthritis patients, people who haven't been able to run for years, are starting to be able to have better lubricated joints, better mobility. And then kind of last nicely is like the skin and the wrinkles. And, it's not, it's not a fountain of youth per se, but I think it's maybe kind of as close as we can get to those things. So those are kind of the main things that I see. I've also had improved gum health reported, and GI health. A lot of we have some dentists using this in practice, especially with like deep pockets and gum disease. So it's a pretty wide range, but I think those are the most common things on a regular basis. And, I would say I usually ask patients to give it 2 to 3 months of taking it consistently to really, see what kind of benefits we're going to see. And then, but I think people see results in as quickly as 2 to 3 weeks with some of the hair thinning and hair loss and joint pain, at least reported back to me from patients.
Yeah, the first month I started taking collagen, I had a handful of people tell me my beard thickened up, which was good because I was trying to get a little thicker in the beard.
Yeah.
Yeah. What about lung? Have you ever seen any issues or improvements with lung? Because I've kind of noticed something myself. I'll tell you in a second.
With lungs?
Yeah.
I don't know. No, I don't think so. But I don't know if that's I don't even know if people would think to would have that much like awareness around that unless we
Mhm.
were telling them to keep an eye out. But yeah, tell me, I want to hear.
Well, and I kind of put this together because I heard about that on another podcast. Like, there's a lot of, well, there's collagen everywhere in your body, so it makes
Yeah, I
sense.
mean, it makes sense,
Yeah,
right? It's not like it just is like picking and choosing where it goes.
right, exactly. So I had some food sensitivities I didn't know about, and it manifested in the form of like basically some pretty severe asthma for a long time, wheezing and coughing. It was horrible. And then I got tested, and sure enough, gluten, shellfish, a whole bunch of things. Uh, but I still had this like little bit of a lingering wheeze every now and then, and I've been on collagen, I think about a year now, and it's virtually gone now. And I was like, I wonder if
Wow.
the collagen has anything to do with it. I think probably.
I mean, it's probably not a far stretch,
Yeah.
just because of the cellular nature of collagen and how it supports everything, which I mean, I think everybody knows, but we should remind them, right, that collagen is a protein that really provides structure to your cells. And it's really found in just about every part of the body, but really concentrated in like the skin, the joints, and your connective tissue. And it really helps provide, lubrication, mobility, hydration, like the fullness of your skin and your joints. And we just unfortunately start to lose this as we age. It is just a natural process of aging, and it's about 1%, of collagen per year. And then by the time you're in your 50s, you've lost nearly 30%. Less collagen than you had, in your 20s. And it just starts to kind of go from there. And that's just the natural degradation of collagen, not really to mention the environmental factors that can accelerate that process, which, I mean, probably not surprising, which is sunlight. And listen, I love sun. It's super important. Like we all know about circadian rhythm and sun, but ultraviolet, rays can break down, collagen fibers and can lead to the reduction in collagen production. So there's kind of that sweet spot balance that we're trying to get to. Smoking can accelerate, I mean, everything really, but for collagen purposes, it can really decrease oxygen and nutrients that are delivered to the tissues, and that can really result in the inability to make collagen. Stress is like, everywhere.
Mhm.
And, but, cortisol can impact how the collagen breaks down and reduce your body's natural production. And then sugar. I mean, high sugar consumption leads to the advanced glycation in products, and that can really damage proteins and can weaken collagen, which once you kind of start that process. So you kind of just have the natural process of collagen breakdown, but then you add in like just our environment and
Just
all the
life.
things that we are managing. Yeah, like life, right? It really can accelerate that process. And, that's the visible signs and feelings that we have sometimes of quote aging.
So yeah, the sugar part is really interesting. So you mentioned glycation. So that glycation is like it's a sugar molecule attaches to something, right? And that will in turn damage that molecule. So this happens to
Correct.
collagen too. That's crazy. I didn't know that.
Yeah. Yeah. Yeah.
Hmm.
Mm-hmm.
Okay. So
Yeah.
let's go into like a little deeper into what collagen is. So there's different types, right? I mean, I know
Yeah.
there's like type 1, type. Can you kind of walk us through some of the different types?
Yeah. So, type 1, 2, and 3 I'm going to probably just talk about those mostly. There's a bunch of other ones, but they're a little less common and
Hmm.
not as, just not as pertinent, I think,
Yeah.
to the conversation. So type 1 and type 3 are probably like the most common that we have heard because they are the ones that are traditionally in a lot of the powdered collagen supplements. And type 1 is usually derived from porcine skin, which is pig skin, bovine or cowhide. It can be pulled from fish or eggshell membranes. There are some out there from eggshell. And it's the one that's commonly found in bone broth or collagen powder. And it is kind of probably one of the more abundant sources of collagen. You've also got type 3 that's hydrolyzed and derived from bovine sources as well. And then type 2 is generally undenatured or unhydrolyzed collagen. And, basically depends on how it's processed, essentially, is kind of what, when we're talking about the hydrolyzation of something. But this is often derived mostly from chicken, honestly, chicken cartilage, and is the type that is thought to, type 2 is a little less commonly found in supplements, except for the one that we're going to talk about. But, the type 2 is interesting because it's thought that we can also stimulate the production of type 1 and type 3 by using certain matrix of collagen, a certain combination of ones. So each of the collagens have a different source, like they're found in joints versus skin versus, so they'll all kind of be found in different areas and concentrated. But those are the main three that are, pretty important. I think it's important just to mention that there's really not a vegan collagen that exists. I get that asked a lot. But there just is not a current source of vegan collagen that is not from an animal source.
So if you're on a vegan diet, you're most likely collagen deficient. Is that fair to say?
Yeah. I mean, yes, I would say it's probably worse than maybe, somebody who is an omnivore or even a pescatarian, I mean, yeah. And I, no shame, right? Or no shade on vegetarians or vegans. But I think if you are a vegetarian or a vegan, you really have to be super intentional with your diet and the choices that you make, because it's a pretty common thing for me to see major nutritional deficiencies in my vegans and vegetarians, including collagen and protein sources. So I think it can be done. I just think you have to be very intentional about the nutrients that you get.
So yeah, let's go a little more into the food sources. So you mentioned bone broth and like chicken cartilage, right? So, but where else how can you get it into your diet more?
Yeah, I mean, I think that best case scenario, right? Just evolutionarily, like if we were back to where we were, where we were eating whole animals, we're eating, connective tissue and ligaments and bones and gnawing on bone. Like, I think we probably would be all right. Like we'd be better than we are now, and we'd be getting those sources. But really the main sources of collagen are going to be in your animal skin, your bone broth, your ligaments. Seafood can be really rich in collagen also. So, I mean, it's mostly animal sources of collagen, and it's sometimes the parts that nobody wants to eat.
Yeah. Like organs.
Yeah, like, ligaments and bone marrow and, all of these things. And that's great. But normally they're like delicacies, like, we're going to a restaurant. I'm like, oh, okay, I'll get that bone marrow because it sounds cool, but you really have to be consuming quite a lot of that daily in order to, I think, really get the collagen enough to really replace. And the other thing, right, is there are nutrients that help with the absorption and production of collagen. And so not only is just the food source of collagen, which is most people, I think, it's going to be like animal skin and bone broth. Like that's probably going to be the main things that people are down with, unless they're eating like knuckles and ligaments and that's fine. Some cultures do, but it's not as common. Then also just a diet that is full of color, right? And has a lot of rainbow, vitamin and a lot of fat soluble vitamins. Vitamin A plays an important role in collagen synthesis and skin cell growth. Vitamin C, we've probably heard around that, but that is essential for the synthesis of collagen. It also has antioxidants, and it's fights for free radicals. Zinc really helps promote healthy collagen production. Manganese is necessary for like the enzymatic reactions to help form collagen proteins. And then hyaluronic acid also helps bind collagen with elastin and creates hydration and skin elasticity. And that's, this is kind of where we talk about a complete collagen or an incomplete collagen. And in my opinion, a complete collagen has all of these components. So we're talking about, a high quality collagen, hyaluronic acid, which is, makes up the structural component of skin. As I was saying, it's like moisture retention and elasticity. And if you have a complete collagen, that's really great. Like the one we're talking about, is it also helps reduce the breakdown of hyaluronic acid, which contributes to aging. And then you also will have some of these other nutrients that are part of that particular supplement. If you're getting a really well-rounded diet, great. You might not need a lot of those other nutrients because you're really hitting on all the key parts. But It's multifaceted, all of these things don't just happen in your body is not like a single cell, right? Nothing happens with a single product. Like you really want this nice combination of things that are going to help round out your collagen production and your collagen stores.
And that's what you mean by bioavailability, right? When it's kind of in its natural form, your body's just going to take it so much better. So I'm guessing, sorry, good.
No. I was going to say, I mean, when I say availability, yes, like in just a very general term does the body recognize this as a bioavailable substance, or does it have to break it down and convert it and dispose of things that it doesn't recognize? And, when I'm looking for collagen, I'm looking for bioavailability in the sense of it is almost the exact same molecular structure and molecular ratio as human cartilage. So in specifically when we're talking about type 2 collagen and looking at chicken sources, because that's where most of the type 2 collagen comes from, what I like to see is a single source. And in this particular case, we're talking about chicken sternum, so it's one part of the animal, not 5 different parts of the animal where you have a lot of risk of lymphatic and vessel touching. And, there's a little bit more risk of contaminants as you're starting to pull parts and grind them all up. Right. And we kind of know that, like the hot dog, of collagen, if you will. I'm looking for a single source, and particularly this chicken sternum cartilage has the exact same ratio of type 2 collagen, hyaluronic acid, and chondroitin sulfate that is the same as human cartilage. And so that's what we mean by bioavailability and bioidentical. So the body is like, oh yeah, okay. Like I've seen this ratio before. This is really similar to mine. Like come right in, no problem. And then we've also, created, there's a patent on this, which is the molecule size with absorption. So we have bioavailability, and then we have bioidentical, we have kind of using these words interchangeably, but when we're really focusing on absorption, that's super important, right? Because you can eat and consume as much as you want, but if the body's not recognizing it and absorbing it in a way that's going to be utilized, it's a waste, in my opinion, which we talked about this in the beginning. Like I'm here to be intentional, like with our energy, time, and money, so that we're getting the most out of what we are, putting into our body. So most often the powdered collagens are a pretty big kilodalton size, which is like super dirty, but it's particle size basically. And, those are not just readily absorbed into the epithelium or into the mucosa. It's really too big. It has to be broken down. And, so you're getting, maybe 10 to 30% absorption, those range, it's kind of a wide range depending on the source that we're talking about. So that's why you take like, huge scoops in your coffee or huge scoops of powder, because we have to just kind of brute force our way through to really get that absorbed. But when we're talking about something that's bioidentical to our cartilage and our collagen and is a super tiny kilodalton size that is really targeted for max absorption, not only do we get, improved absorption, like you can swish it in your mouth and get absorption through the mucosa. Like especially, patients who have had gastric bypass or other kind of GI disorders where there might be some absorption concerns. I really ask my patients to like swish it in their mouth for as long as possible to make sure that we're getting max absorption. And then you're getting down into the gastric mucosa and the small intestine where the majority of absorption of these nutrients and particles happen. And because it's such a small particle, you're getting up to 98% absorption of that product when compared to, smaller portions with the larger kilodalton size of the particle.
Does it matter if it's liquid or a powder? Does that factor into the absorption rate?
Yes. I think there's probably various opinions on this. And there's lots of different studies out there around, does it really matter if something's liquid or not? And, my argument would be, yeah, I think it probably does because of how small you're able to get the particle and how well it's absorbed. But I think really the majority of the point is the size of the molecule. And I don't know that I know enough about like how small a particle can be in powder form and how that is absorbed. So I'm not 100% sure, but my instinct would be that it does matter. And that usually, you have different gradients and different absorbability with liquid, but I think the size of the particle is probably the most important part in that particular like question.
So basically, I'm guessing the sort of Costco powder collagen is going to be somewhere in that 10 to 30% absorption. And the one that we love is closer to 98%.
Correct.
Okay.
Yeah. I get it. It's a nice price point. It's like great to be able to think that you can just like go buy a bucket of powder and put it in your coffee and call it a day. But, I think it just isn't what we need it to be. And, when you start to have, as we talked about, multiple sources, you're getting it from like bovine and pig, and it's all kind of ground up parts, or you have fish scales, and you have the whole microplastic thing. Like when it comes to fish and scales, you've got microplastics and radiation and environmental pollutants, and it's just, there's a lot of things, and it can be a little stressful to like, overwhelming to try to like keep it all together. But this is why we do what we do, because there's so much information out there that it is super overwhelming to kind of just the normal consumer. And I think that's where we come in, is like, okay, don't worry about it. We'll take it from here. Like we'll do the vetting, we'll do the research, and then we're going to like regurgitate that information back to you in a way that makes sense, because it's stressful. It's like, think about all the things that you have to pay attention to. So that quality of source, not, particularly, I think you and me and most of the people I work with are like very adamant about, GMOs and glyphosate and hormones. And, that's really something that I pay close attention to, is what's the source of this, non-GMO, no hormones, glyphosate free, naturally raised, just kind of checking as many boxes as we can to make sure that the quality of the collagen source is up to par, with where we want it to be.
And just for listeners, when she says glyphosate, that's Roundup. That's the pesticide that's pretty nasty. They spray on everything. So you definitely don't want that in your diet. So
yep.
Collagen, good for everybody. Is there specific times or clients that you think really need to pay attention? Like I'm thinking injury or surgery or something like that.
Yeah. Good question. So for sure, anybody everyone can benefit from collagen. And I think there's kind of, for me, two sections. There's the person who is, wanting to optimize, they're getting into their third, fourth, fifth, sixth decades of life. They want to try to stay active. Maybe they want their skin to be, a little more plump, or they just kind of starting having aches and pains. Great. Perfect. I think that is a great time to start, incorporating collagen and kind of making it part of your normal routine. And then I think, there's training for a marathon, training for a triathlon, recovering from an injury, surgery, even recovering from surgery, like wound healing and tissue repair. That I think is a must, like not just a maybe. I mean, it is a must. And I have seen and heard so many crazy stories about the accelerated wound healing, that comes from the collagen production. People that had, major injuries that are healing much faster and getting back, to the things that they love and enjoy, or they feel like their training is so much better if they're training for a marathon or whatever it might be. So I think everyone for sure, but I think especially, wound healing, injuries, training, those types of things. And sometimes we'll even double the dose, like we'll do a higher dose in those, for the short-term period. There's been a lot of studies on this. It's like, I don't know, I think it's like 30 times the upper limit or something for toxicity. Like it's not, it's really hard to be toxic on collagen. Right. Exactly. So Yep.
Yeah. I'll tell you, I tore my meniscus playing soccer in my yard with my son. I kind of stepped on a little pothole and tore my meniscus.
This is how we go down as adults. This is how it is. Yeah.
So I drank bone broth every day for a month, and it completely went away. I didn't do anything else. Like I'm a physical therapist. I know the things to do. I didn't have to. I just drank bone broth every day for a month. And I was like, that's it. I'm having bone broth every day. But then it became too taxing to make it.
I mean, that's kind of the point too, is like, I think there is a way to probably do this naturally, but it's just not super sustainable. Right. And it's really hard, and it just takes so much intention and effort, and it's super labor intensive. And and that's okay. That's just where we're at as humans in our current world, is just like trying to find the best answer that is sustainable. Like
Yes.
that's like where we're at in life, you know?
So the collagen that we're talking about, we're kind of teasing you a little bit. You're going to have to contact us to find out more about it. And I think we have a discount we can offer. Is that right, Tracey?
Yeah. We, you know, this is kind of one of those things where we want everybody to try and know and be informed and really be using a high quality collagen. So yeah, we have some $25 off and some different new customer discounts that we're happy to share with you. The great thing about this is there's a 30-day money back guarantee too. You know, the goal really is to help people find their healthiest selves and to really find things that are going to work for them. And if it doesn't, then great. You know, we want to make sure that you find the things that you like and that pay attention to what feels good for your body. But yes, happy to share. And always we love talking about it. So if people have more questions, I'm sure we will find the time to answer them for people.
Yes, I've now become obsessed with collagen myself. So if you want to find out more, email me, info@dynamicnaples.com, or I'm putting a form in the show notes. You can fill out that form and we will respond to you. Outside of that, is there anything we missed on collagen, Tracey?
I don't think so. I think we got almost all of it. And I think just to reiterate, quality of the source, single sourced, non-GMO, no added sugars, all of the things that we really care about. And then you want that bioidentical nature of the product that has that same ratio of collagen, hyaluronic acid, and chondroitin sulfate that we have in our bodies, what we're calling a complete collagen. And that's really why we talk and are so passionate about this, is we really want to make sure that the right things are getting into the body so that we can really get the most out of our energy, effort, and time.
So yeah, so you can either memorize everything she just said or contact us and we'll help you find the right one.
Yep. Follow us on social media. We love to talk about it as well. And we're here to answer any questions that you have.
Yeah. How do people find you, Tracey?
Yeah. So on Instagram, it's Tracey_A_O'Shea FNP. And you can also find me on Facebook at Tracey O'Shea.
Perfect. I'll put that in the show notes as well.
Perfect.
Okay, Tracey, I think you knocked it out of the park, and I think we're ready to wrap this one up. So thank you so much. I really appreciate you taking the time to come on the podcast.
No problem. Thanks for having me. I love chatting about it, so I really appreciate the time.
All right. I'll talk to you soon.
Okay, bye.
A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with a goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.